Thank you, and thank you all for the kind welcome. It's a real privilege to do this talk, and I'm really excited to get to do it in person. I did something like this last year, but it was virtual, and it's much better to be seeing faces. So thank you for coming. So I just have some quick disclosures for you all to see. You should be aware that I am an author on a pending patent application for a way to diagnose mitochondrial disorders, and that I've received research funding from various foundations, including the United Mitochondrial Disease Foundation and the NIH. So in this talk, what we're going to do is I'd like to frame this as questions. So we'll start out by asking how genetic changes cause genetic mitochondrial diseases. And then we'll talk about what questions we should be asking about diagnosis and care, where we can get answers to those questions, and who to reach out to for support. And I apologize, this is a short talk on a vast topic, so there will inevitably be more details that we aren't able to cover today. So starting with the how genetic changes cause mitochondrial diseases. So that kind of begs the question, what is a genetic mitochondrial disease? So as clinicians and as scientists, we kind of have three different ways we think about this. We can describe a disease or disorder in a clinical manner by its symptoms and clinical signs. In mitochondrial disorders, we often, in the past in particular, have used biochemical tests to help us understand and diagnose these conditions, including tests that were done on blood and tissue. And most recently, we started using genetic testing, which is gene sequencing. And that's been kind of one of the organizing features and thought processes around mitochondrial diseases. So let's start with the clinical. As you all probably are aware, because almost every cell in our bodies have mitochondria, if you have a problem with your mitochondria, you can have a problem in almost any organ system in your body. And I've summarized some of these here for you on this cartoon, but I'd like to talk about them in the context of syndromes, because no single system manifestation or symptom is diagnostic of mitochondrial disorder. However, if you take certain symptoms grouped together, that can be highly suggestive. As I mentioned, they can involve almost any organ or body part. And the average patient, studies have shown us, can have as many as about 16 different medical problems in mitochondrial disease. So some of the clinical syndromes you may have heard of or you may find when you do reading include things like Lee syndrome. So this is the most common clinical syndrome that will affect children who have mitochondrial disorders. And in Lee syndrome, what I've done for you here is to bold the symptoms in this figure that are features of clinical Lee syndrome, and they can include encephalopathy, developmental delay, movement disorders, hearing loss, vision loss, as well as cardiomyopathy, diabetes, and other features. But the neurologic ones in particular are the most characteristic. Similarly, mitochondrial encephalopathy with lactic acidosis and stroke-like episodes, which we abbreviate MELOS, can affect many organ systems. It is defined by having brain disease, and that will be either a stroke-like episode or seizures. These patients can also often have hearing loss, and they can also have heart disease, including cardiomyopathy or problems with the rhythms in their hearts, and will very commonly have diabetes as well. And then at another end of the disease spectrum, we have a clinical syndrome called Leber hereditary optic neuropathy. And some of you will probably have seen this term and be familiar with it, but this is a mitochondrial disorder where almost the only clinical symptom is vision loss. So you can see we have a whole spectrum of disease severity and a broad multi-system spectrum of disease that's possible. But every mitochondrial disorder is different. And every patient, even within the same clinical syndrome, will have differences in symptoms, difference in severity, and different experiences, which is one thing that makes these diseases so difficult to diagnose and to treat. Every patient and every family is unique, and every patient within a family. We can have siblings who have the exact same gene, for example, who will have very different experiences. And that makes it really difficult to predict what's going to happen in the future. And what I always tell my patients is, while that is incredibly frustrating and that uncertainty is very difficult to live with, I always hope that it also leaves a little room for hope. And it's important to say that when you have this much diversity in a disease process, information you find about one disease may not actually be applicable or correct for another. So take everything you read about one disorder with a grain of salt. Now moving on to biochemical. So talking about these tests that prior to the genetic sequencing era were really our bread and butter for diagnosing mitochondrial disorders. So I've shown you this cartoon. We're talking about organ systems, but let's take a step back and remember that our body is made up of cells, right? Every organ type is made up of cells. And if you think of these cells and blow them up in a big picture like I have in this cartoon for you, the cells have many different parts inside them. And what I've shown for you in green here in this cartoon are the mitochondria. And literally almost every cell in our bodies have mitochondria. What do mitochondria do? Well, one of the first things that we as a human species and scientific field determined that mitochondria do is to make energy. That's why you hear the term powerhouse of the cell and so on. But that's not the only thing they do. So they do perform oxidative phosphorylation to make ATP, which is the energy currency of the cell and how our body has the energy it needs to do everything it does. But they also do many other metabolic reactions. They are bakers, if you will, in our body. They make fatty acids, amino acids, and vitamins that our bodies need to perform all of the things we do every day. They also do detoxification reactions. And they signal within and between cells, including in the immune system, something I think we are actively learning about in this day and age. Mitochondria are also often the gatekeepers in the decision for a cell to die. So all of that is just to say there are many jobs the mitochondria do, but these first tests that we historically have used to determine whether there's mitochondrial dysfunction or not are focused on this one task primarily. So in the past, people would use blood perhaps, or a tissue specimen from a biopsy. They'd grind it up and they would look to see if chemical reactions were being performed as we would expect in the oxidative phosphorylation process using UV adsorbents. And that's as technical and as complicated as it sounds, and I've grossly oversimplified. So to do that, when you do that, you can find that there are problems with the function of the mitochondria, but that can be caused by many different things. It may, in fact, be due to the fact that there is a gene that the mitochondria needs to perform its functions that is missing or not working correctly. It could also be that there are other genes in the body that are not working properly. And we are increasingly learning, now that we can do genetic testing on more and more patients, that other genes that don't necessarily work inside the mitochondrion can cause abnormal results on this type of testing. So for example, cystinuria hypotonia syndrome, which is a disorder of cysteine metabolism, disorders of congenital glycosylation or deglycosylation, which is a matter of putting sugars on proteins to build pieces of our bodies and send signals in our bodies that are not involved with the mitochondria. Dravet syndrome, which is a canonical epilepsy syndrome that's caused by a mutation in a sodium channel gene, and different myopathies, the list goes on, all of which is to say, this test, even when it's done by the most expert individuals, isn't gonna specifically pick up on one type of problem. And then I'm gonna try to make an analogy here, and you'll have to forgive me because I don't know much about cars, but I thought perhaps cars was a good way to make an analogy here. So you can have a problem with your tire, right? And maybe that's because the tire you bought was just made wrong by the factory or not made well. You can also have a problem with your tire because you ran over a nail. And in that case, I would say the analogy is something like toxins that we know can poison mitochondria and cause human disease. You could also have a problem with your tire because your axle is bent and the tire is wearing improperly every time you drive the car. And that's the analogy I would make for some of these other genetic and metabolic disorders causing mitochondrial dysfunction. It stands to reason that if one part of the cell isn't working as well as it could be, that it might affect other parts of the cell, correct? So lots of causes of abnormal findings on these tests. And unfortunately, these tests themselves don't give us enough information to be able to tell the difference. So it was a really revelatory thing in the early 2000s when genetic testing was finally broadly available. Prior to that time, your doctor had to think of one specific gene that we knew could cause the same medical problems that we have in a patient and send testing for just that one gene, and it was incredibly expensive. And then in about 2006, we were suddenly able to test dozens or maybe 100 or so genes together at the same time for the same cost. And then in about 2015, we were actually able to start sequencing every gene in the exome, which is something a lot of you are probably familiar with, and use the results from that to start making more and more diagnoses. So what is genetic mitochondrial disease? You all will remember, and forgive me, I know I'm oversimplifying, but we all get DNA from each of our parents. Our nuclear DNA, which is what I think most people think of when we think of like 23andMe genetic testing, we get 23 chromosomes from mom and 23 from dad. And that's where we get all of our nuclear DNA from. What they often don't tell us, in high school at least, is that there's another genome, a whole nother set of DNA that we only get from our mothers. And this is the mitochondrial DNA. And as I've shown you here in this cartoon of a cell, those mitochondrial DNA, there are many of them in every mitochondria and in many mitochondria in every cell. So we literally have hundreds, if not thousands of copies of mitochondrial DNA in every cell in our body. And we only get this from our mother because only the egg cell has mitochondria in it. And some mitochondrial disorders that are due to a genetic problem are due to genetic problems in the mitochondrial DNA. Not all of them. Many of them are from the nuclear DNA, but some of them are from the mitochondrial DNA. So in that case, you could only get a mitochondrial DNA disease from a mother, and you cannot inherit it from a father. So again, we have these two sets of DNA, and the mitochondrial DNA is important because it contributes parts to the mitochondrion as well. In fact, we have 13 gene products that come from the mitochondrial DNA and 1,300 or so that come from the nuclear DNA. And here I've got a cartoon for you with a list of all of those roughly 1,300 genes in really small print. And I'll show you that about 300 of those, as I've highlighted here in red, have been linked to human disease. And that number will obviously be increasing as we learn more and more patients get testing. So In our nuclear DNA, we have about 60,000 genes, 20,000 of which become proteins. 1,100 of those or so are going to work inside the mitochondrion. In the mitochondrial DNA, we have 37 genes, 13 which become proteins inside the mitochondrial DNA, inside the mitochondria, and the rest are either RNA or mRNA, other parts of the mitochondria. And all 37 of those mitochondrial genes, mitochondrial DNA genes, have been linked to disease, and more than 300, as I mentioned, from the nuclear genome have been linked to disease thus far. So, as I mentioned before, there are other things that can look a lot like mitochondrial disease, including other genetic conditions. And again, things like infection could similarly look like a mitochondrial disease. I think a lot of you are familiar with things like Lyme disease or other systemic infections that can cause problems in multiple parts of the body and look similar to a genetic mitochondrial disease. Autoimmune disease, where the body's immune system is attacking itself inappropriately, can also affect many parts of the body and produce similar symptoms. And all of these can actually cause secondary damage to the mitochondria without actually having perturbed the mitochondrial genes themselves. So like I said, you can run over a nail with your tire, or you can have a problem with your axle and cause a problem with your tire, even though it's nothing wrong with the tire itself. So what if you have had this sequencing and you don't have a genetic diagnosis? Well, sometimes there are physicians who are very experienced in the field, who are able to look at all the symptoms and all of the data, maybe the MRIs or the biopsies or the blood tests, and say, this is highly likely to be a genetic mitochondrial disease. We just haven't found the gene yet. Some patients will have other causes for their symptoms identified. The list of other diseases I just told you before, those are all published cases of patients who were identified as having a mitochondrial disorder based on biochemical testing, who were later found to have those gene changes instead. And in many cases, patients won't find an exact diagnosis, and that is a struggle. It's difficult when you have to explain to people what's going on in your life and with your medical problems. It's always easier if you have a shorthand and you can say, I have condition X. It doesn't mean your symptoms aren't real or important. It just means that, unfortunately, we don't have a good explanation for them. And I will also say that oftentimes, if you've had genetic testing and you have not had an answer identified, it's always worth revisiting with your physician every 2 to 5 years or so, because we do discover a new gene disease association roughly every 2 weeks to 2 months. And we also discover new ways of testing for genetic conditions, not quite that frequently, but rapidly. So what questions should we be asking about diagnosis and care, and where can we get answers for those questions? So many people will ask, what are the risks to current or future children if someone in my family has a genetic mitochondrial disorder diagnosis? So as I mentioned before, there are many different modes of transmission, and it's going to vary depending on the exact gene that's affected. Some family members may be at risk, while other family members may not. And the risk will vary for any future pregnancies based, again, on the mode of inheritance. And if you or a family member have a genetic diagnosis, the best thing you can do is ask your provider or your genetic counselor to discuss the risks that are posed to other family members or future children based on your diagnosis. And in fact, I strongly encourage anyone with a known family history of a genetic condition of any kind to get preconception counseling before they're thinking of having children, and know what the risks are for passing it on, and know what might or might not be available to decrease that risk. symptom management and treatment. So unfortunately, right now, as we stand here, there are no FDA-approved targeted treatments for genetic mitochondrial disease. We don't have any medicines that we specifically know will boost mitochondrial function in a way that we have proven. And in most cases, what we have to do is just treat each medical problem as we would in any other context. So for example, if a patient has seizures, we would give the same medicines with a couple of important exceptions that we would give for any other patient who had seizures or heart disease and so on. So you've heard a lot probably already about mitococktails. So mitococktails are is a term used to describe the prescription or use of various vitamins and cofactors that we empirically infer would be helpful if you have a problem with your mitochondria. We say, oh, we know that to make ATP, the mitochondria need coenzyme Q10. So perhaps it would be helpful to give coenzyme Q10 or thiamine, and we will often prescribe these. What you should know is that almost every doctor you go to is going to prescribe something slightly different because this isn't proven, because we don't have large studies and prescribing guidelines. Generally speaking, supplements are going to be safe, but you should always check with your provider to understand the parameters for safe use, and always tell your provider everything you're taking, even if you've bought it, over the counter at the grocery store, because even herbal medicines or supplements can interact with each other and with other medications. Unfortunately, right now, it is usually not covered by insurance if you are taking a medication or a supplement that can be bought over the counter, and that is just the unfortunate current state of affairs. The UMDF has a wonderful link with information about this that I've put here in the slide, and I think you all will have the slides for reference. But I will emphasize that as far as targeted therapies, and I have a slide for this at the end, there are many clinical trials underway, and as you may have seen already, we have many people working very hard to come up with the most rigorous ways to conduct these clinical trials and figure out if they're actually working or not. It's the focus of a lot of really great research right now. And you can always look for any clinical trials that might be relevant to a condition you have, and that's any condition, mitochondrial disorder or otherwise, at clinicaltrials.gov. And I always strongly encourage patients to do that because it will have the most up-to-date information. And as always, talk to your doctor, talk to your clinician. So one topic that's really important, because we want to make sure that there are certain medications that patients avoid, but also we want to make sure that there are not patients who are undertreated because there's a misconception about what medications they can take. This medication contraindication concern. So always, always, always talk to your doctor. So as our understanding of genetic mitochondrial disorders and mitochondrial dysfunction broadly has grown, we're increasingly realizing that some of the things that we thought in the past were not safe for patients actually are fine. I mean, for example, if you Google, you'll probably see something like Tylenol shouldn't be taken by patients with mitochondrial disease. And what I always tell the doctors in training about Tylenol or acetaminophen is it's the same parameters as you would for any other patient. If somebody has liver disease, they need to be very careful about taking acetaminophen. If they don't, and in any case, they should only be taking the indicated amounts. But again, here, every mitochondrial disease can be different. Some disorders will have specific contraindications that are not relevant for others. As I mentioned, older lists that you will find all over the place on the internet are really outdated, and you should talk to your provider, and you can refer them to some of these websites if they're not familiar. So www.mitosociety.org is a great resource. One medication that I will make a special point of bringing up, though, is valproic acid or Depakote, Depakine. As a neurologist, I know that this medication is a very good and important medication when used in the right population, but anyone who has a variant, a pathogenic variant, or what we used to call a mutation in polymerase gamma or POLG, should not be given this medication. There are antibiotics similarly that should be avoided. It's really one subclass in particular and one pathogenic variant in particular where that's the most sensitive. And there are some medicines that, while they aren't strictly contraindicated, these medicines can cause increase in lactate and lactic acid in our bodies, in anyone's body. And if you're prone to lactic acidosis, you can imagine that we might want to avoid those in your case. And there are also medicines that can cause muscle weakness or nerve function in any individual. So if you're somebody who has a genetic susceptibility to having neuropathy or myopathy, we would prefer to avoid those medications for you as well. And again, some medications should be avoided if a patient has specific medical problems, whether those are caused by mitochondrial disease or something else. As I mentioned, the example of liver disease, there are certain medicines you always have to be careful with, no matter what the cause of the liver disease is. Same with kidney disease and so on. So diet and nutrition. You'd think that given the central role of the mitochondria in metabolism, perhaps there might be some very highly prescriptive diet. And the truth of the matter is there's not a specific diet that we would advise somebody who has mitochondrial dysfunction to have. I strongly encourage you to talk to your provider. We often have goals for caloric intake and the sources of those caloric intake, and we would often prefer for that to be guided by a dietitian. But it's going to vary by individual and by condition. But as with any individual, keeping a healthy weight is often our prime goal. I will say, though, that broadly speaking, if you have a disorder of mitochondrial energy metabolism, eating small, frequent meals throughout the day is often a healthier approach than not. And in some cases, particularly for things like disorders of fatty acid oxidation, it's really important that patients avoid fasting. But again, your doctor should be giving you advice specific to your condition. So exercise. This is a real tough one because there is actually good evidence to suggest from many of my colleagues that exercise will improve mitochondrial dysfunction if you have mitochondrial muscle disease in particular. But because mitochondrial disease can affect things like the heart, it's very important to talk to your doctor and make sure that whatever exercise regimen you're doing is safe. Some of my colleagues at the University of Vancouver have an excellent guidebook that can be shared with your physical therapist to help provide exercises that someone with mitochondrial disease can do even on days when they are feeling the most fatigued and weakest. So make sure you're safe, and if you need to see a cardiologist first, please do. In general, like I said, we think the exercise is beneficial, but always listen to your body and tell your family member to listen to their body and rest when you need to. Important potentially decompensating factors during exertion for patients who have mitochondrial problems can also include things like temperature and humidity. So if it's very hot, very cold, be aware of that. And I always tell my patients to aggressively hydrate, and I always make sure that my patients who are taking part in school activities and so forth have letters making their teachers or coaches aware that they may need to stop activities to rest and that they need to be allowed to do that. I will make the point also that it's not just aerobic exercise, but also strengthening exercises that can be beneficial. And for children, as I mentioned, you might need a 504 or an IEP in addition to a doctor's letter to make sure that the children have safe and appropriate programs for physical activity at school. You can get more information at the UNDF website. There's an excellent packet on exercise and mitochondrial disease. MitoAction also has a guide available on their website as well. So emergency care. So metabolic stress, we know, can worsen health in people who have mitochondrial disease. We talk about regressions and decompensation. And what are those metabolic stresses? Well, they include things like infection, fever, dehydration, starvation or fasting, and surgery. So any person with a mitochondrial disease should have an acute care plan. These days, in our electronic medical records, we can put those directly in the chart so that anybody opening the medical chart will immediately see it. Your doctor should also provide you with a copy of this plan. I like for my patients to have a copy available that they can just pull up on their phone anywhere they go, so that if you happen to be in an emergency room that's not part of your mitochondrial disease doctor's network, you can show it to them. And you can refer your physician, if they're not familiar with these, to the webpage provided by the Children's Hospital of Philadelphia. They have an excellent template for an emergency action plan. So how about if you know you're going to have surgery and anesthesia associated with it, or anesthesia for an MRI or something along those lines? So your mitochondrial expert should be able to collaborate with the anesthesiology team you're going to be working with. At most large centers, anesthesiology teams will be very well familiar with these disorders, but it's always worthwhile to review. And plans will include things like measures to make sure there's adequate calories and energy sources before, during, and after the procedure, adequate hydration before, during, and after, and any extra monitoring that might be necessary. So health insurance. I wish this didn't have to be part of an introductory talk, but it does, unfortunately. So one of the best things you can do for yourself or your family members to understand your plan and your options. I strongly encourage all my patients to look into secondary insurance plans. In Massachusetts, we have the Cayley-Mulligan program that will provide supplemental Medicaid at a discounted price. Also, you might need to look into predetermination and explanation of benefits before certain diagnostic testing or procedures. And there will often be a lot of use in having a case manager assist you. Sometimes specialized care centers will have case managers and social workers who can help. If you are a pediatric patient, the pediatrician's offices often have case managers who can also be helpful. Now, who do you reach out to for support? So be aware that this is a difficult thing to learn about, always. And everyone will react differently. Everyone will carry their worry for themselves or their loved ones differently. They may feel burdened with responsibilities or even overwhelmed. A lot of people feel pressure to suddenly become an expert, and let me share with you, I know that any clinician you're working with will feel the same way. We do our best to worry so that you don't have to, or to relieve that burden as much as possible on you. But if you're having difficulty doing everything you need to do in addition to the medical care, make note of that. If you start feeling overwhelmed and you feel like you can't talk to people about it, or if you're stressed out about the financial uncertainties or the medical uncertainties, never worry alone. Don't carry this on your own. These are signs potentially that you might need to find support. And the United Mitochondrial Disease Foundation is a great place to find that, both for peer support, and they can also help you find clinicians who can help support you. Same with Mito Action. And there are many local and regional groups, or groups specific to specific types of genetic mitochondrial disease. And their websites can often be helpful, but you should always be aware that everybody's experience can be different. I know sometimes joining a group or forum can be hugely meaningful and helpful to people, but sometimes it can also be distressing. If you see somebody who is sicker than your loved one, or someone who's doing better than your loved one, either way, it can be anxiety provoking. And just be aware of that and know yourself, and do your best to anticipate how that might affect you and act accordingly. Because again, no two experiences are exactly the same, and no one else's experience is going to be predictive of your own. So also keep in mind that while we all learn so much from each other, and as providers, we often learn so much from families, it's always good to run anything you're just thinking of doing by your physician or provider to make sure that it is safe for your specific condition. So you're going to need a care team probably if you have a mitochondrial disease, as I led by showing you many different organ systems can be involved, and unfortunately most physicians are not going to be capable of doing all of it. Most people are going to have a geneticist and or a neurologist. That individual will help confirm the diagnosis and proactively screen for other medical problems and help you know to the best of our ability what you might expect. And as I mentioned, predict risk for other family members. Having a mitochondrial expert is also really helpful in knowing what is the latest and the greatest in the field as far as clinical trials or new standards of care and innovation. And with that, I will leave you with, unfortunately not as high resolution as I was hoping for, but what I think is a very hopeful slide. When I first started in this field about 10 years ago, there were maybe 3 clinical trials, maybe. And as you can see, it's really expanded. And I have a lot of hope for the future. I encourage you all to go to these websites to learn about more research opportunities if you are interested. With that, I'll end and I'll take questions.